Welcome. Today we're diving into a rare and devastating neurodegenerative disorder known as Sanfilippo syndrome, also called mucopolysaccharidosis type Ia, or MPS-E2. This condition primarily affects the brain and spinal cord, leading to progressive mental and motor decline. Let's explore what makes Sanfilippo syndrome so challenging and what we know about it so far. Sanfilippo syndrome is caused by genetic mutations. Specifically, it's an autosomal recessive disorder. This means that a child must inherit two copies of the mutated gene, one from each parent, to develop the condition. The genes involved are responsible for producing enzymes that break down complex sugar molecules called glycosaminoglycans, or GIGs. Without these functioning enzymes, GIGs build up in the body's cells, particularly in the brain and spinal cord, causing damage over time. The root of Sanfilippo's devastating effects lies in the accumulation of these GIGs, specifically heparan sulfate. In healthy individuals, enzymes diligently break down these molecules, preventing build-up. In those with Sanfilippo, the defective enzymes are unable to do their job properly. The undigested heparan sulfate progressively accumulates within lysosomes, which are cellular structures that function as recycling and waste removal centers. This buildup disrupts normal cellular functions, leading to inflammation, cellular damage, and ultimately, neurodegeneration. The brain is especially vulnerable, leading to the cognitive and behavioral symptoms characteristic of the syndrome. Sanfilippo syndrome is a rare disorder. Estimates suggest it affects roughly 1 in 70,000 to 1 in 100,000 live births. However, the true incidence may be underestimated due to diagnostic challenges, particularly in the early stages of the disease. While it occurs in all populations, some studies suggest slightly higher prevalence in certain geographic areas, but overall, it remains a globally rare condition. The symptoms of Sanfilippo syndrome typically begin to appear between the ages of 2 and 6, though sometimes they may not be apparent until later. Initially, parents may notice subtle developmental delays, such as speech difficulties or slower learning. As the disease progresses, behavioral problems like hyperactivity, aggression, and sleep disturbances often emerge. Cognitive decline becomes increasingly evident, leading to intellectual disability. Motor skills also deteriorate, causing clumsiness, difficulty walking, and eventually, loss of mobility. Other symptoms can include coarse facial features, chronic diarrhea, hearing loss, and recurrent respiratory infections. Diagnosing Sanfilippo syndrome involves a combination of clinical evaluation and laboratory testing. Doctors will assess the child's symptoms, developmental history, and perform a physical examination. Suspicion arises from the combination of developmental delays, behavioral issues, and characteristic physical features. A urine test can reveal elevated levels of GIGs, suggesting a mucopolysaccharidosis. Definitive diagnosis requires enzyme assays, which measure the activity of the specific enzymes deficient in each type of Sanfilippo. Genetic testing confirms the diagnosis by identifying the causative mutations in the respective genes. Sanfilippo syndrome is classified into 4 main subtypes based on which enzyme is deficient: type A, type B, type C, and type D. Type A is the most common and often the most severe. Type A is caused by a deficiency in the enzyme heparan N sulfatase. Type B results from a deficiency in alpha and acetylglucosaminidase. Type C is due to a deficiency in acetyl-CoA alpha glucosaminide and acetyltransferase. Finally, type D arises from a deficiency in N-acetylglucosamine 6 sulfatase. While the underlying cause differs for each type, the clinical presentation and progressive nature of the disease are generally similar. Currently, there is no cure for Sanfilippo syndrome. Treatment focuses on managing symptoms and providing supportive care to improve the child's quality of life. This may involve therapies to address behavioral issues, speech therapy to improve communication, physical therapy to maintain mobility, and occupational therapy to aid in daily living skills. Medications can be used to manage seizures and sleep disturbances. Assistive devices, such as wheelchairs, may become necessary as motor skills decline. A multidisciplinary approach involving doctors, therapists, and social workers is crucial in providing comprehensive care for individuals with Sanfilippo syndrome and their families. Because Sanfilippo syndrome is a genetic disorder, there is no way to prevent it in the traditional sense. However, genetic counseling is highly recommended for families with a history of the disease. Carrier testing can determine if prospective parents carry a mutated gene. If both parents are carriers, they have a 25% chance of having a child with Sanfilippo syndrome with each pregnancy. Understanding these risks allows families to make informed decisions about family planning, including options such as preimplantation genetic diagnosis, (GD), or prenatal testing. Unfortunately, the prognosis for individuals with Sanfilippo syndrome is generally poor. The disease is progressively debilitating, leading to significant cognitive and motor impairment. Life expectancy varies, but most individuals with Sanfilippo syndrome do not live beyond their teens or early 20s. Recent research efforts focused on developing potential therapies, including enzyme replacement therapy, gene therapy, and substrate reduction therapy, to address the underlying enzyme deficiencies and slow down the progression of the disease. Clinical trials are ongoing, offering hope for future treatments that may improve the lives of those affected by this devastating disorder.